My name is Richi Chaudhry. I'm the System Director for Clinical Integration and Performance Improvement at Memorial Hermann Health System in Houston, Texas. Our system has found several ingredients that are helpful to initiate a collaborative. We're still in the early phases of developing our collaborative, but to initiate it, we've found that sharing transparent data at all levels, from the system level, the facility level, down to the surgeon level, as well as by specialty, has been very helpful in engaging in starting our collaborative. Currently, we've been establishing what projects to work on by reviewing our individual hospital SAR site summaries. However, we do want to transition in the future to reviewing our collaborative reports as a system so that we can start to look at data for our entire system rather than individual hospitals. Since we've been focusing on individual SAR site summaries, our projects have been limited in scope. And so our timelines vary depending on the topic, depending on the problem being identified, anywhere from a month to a year, depending on the resources that the project may require. Engaging our surgeons has been a challenge because the data is limited to a sample. So we've started to look at specialty-specific reports. We've engaged our leadership by reviewing the reports and identifying opportunities in the outcomes for the specific hospitals. We've also engaged a lot of our quality teams by reviewing data and then finding correlation through other data sets and identifying the problems that are similar in the data sets. So we've used different strategies for different groups. Sharing culture is a very complex concept. I think for us, what has really worked is by sharing our successes, we've been able to engage different groups. And so we're trying really hard to encourage sharing of successful stories, projects, ideas, concepts within our group. We're hoping to start more regular meetings, whether that's through teleconference or in person, and we're really hoping to engage many different groups and increase the sharing within our groups. I think sharing our challenges and barriers also brings the groups together, so we definitely do that as well. We're going to start sharing our successes a lot more, I think, to bring the groups to share the progress they're making in their teams. But definitely our goal is to identify problems and then to go ahead and work on projects to improve the care for the patient. We have learned as a collaborative, it is very hard to have a collaborative with a system as large as ours. The important lesson is that you need a lot of leadership and executive support to sustain a collaborative as large as ours. We are not a state collaborative, but still within a system, there is a lot of barriers and a lot of challenges from a resource standpoint. Having the leadership support really helps move the collaborative forward. NSQIP is a fantastic tool to utilize to improve patient outcomes. I do think we struggled a little bit with developing the structure around how to use the data. We focused a lot in the initial phases of our implementation on how to abstract the data. And then we went towards how do we create reports that are meaningful, useful, and how do we disseminate those reports. And then the third phase really was, what do we do with this data? How do we do the performance improvement around this data? The important thing we realized is that we really have to align ourselves with the system priorities. What are the goals for the entire health system? What are we focusing on? And then utilize the NSQIP data to support those goals. And that's a more successful strategy than trying to look at just the data and then funnel down to the problem. The NSQIP team is fantastic. I've really enjoyed working with the entire ACS NSQIP team. Our hospitals also engage with the NSQIP program as well as the pediatric NSQIP program. So all of those components, we've really enjoyed working with the team. If I could give advice to someone starting a new program, and I have spoken to new programs that are starting, I would say build contacts. Speak to other folks that have done this, learn about the challenges they faced and how they addressed those challenges. What were their barriers? What did they do to remove those barriers? What are some of the successful things they implemented that worked for them? I think that talking to other hospitals as much as possible is probably the best way to start a new program.